Hello, my name is Lauren McDonald, and this is going to be my honors project for Psych 320. So I have shadowed a few practitioners over the course of this semester, and I just wanted to say the things I learned, the things I liked and disliked of the different professions that I shadowed. So over fall break, I shadowed a physician assistant in transplant surgery. I actually went to Seattle to shadow her at UW Hospital. She's specifically in liver and kidney transplants. I absolutely loved shadowing this PA. I found the autonomy to be incredible, but also the communication and teamwork to be one of my most favorite aspects of this shadowing experience. So we arrived at the hospital around 6:30 in the morning. We started pre-rounding, looking at her patients for the day, looking at their chart numbers from the following night. And then we did our pre-rounds, asked the patients how they were feeling and if they needed anything specifically right now. Once pre-rounding was done, it took about 30-45 minutes. We started our actual rounding with the referring doctor. We saw some fellows, some nurse practitioners. This is where we advocated for our patient and what we thought they needed for the day and how we can get them home as quickly as possible and as safely as possible. During this shift, we only had one patient that was available for discharge. So our goal that day was to get their numbers level, and they needed PT, OT, and pharmaceutical clearance. So as a PT, she is the communicator with the physical therapist, occupational therapist, any other nurses, nurse practitioners, referring doctors, and fellows. She was the one communicating to those people on her patient. That was one of my favorite aspects of this, is that this PA was the go-to for anything that the patient needed. And she also had the autonomy to do everything herself. She could prescribe herself. She could run tests herself, read x-rays, and things like that. Something that I didn't love about this shadowing experience is that it was a 12-hour shift, kind of turned into a 13-hour shift, so I was pretty exhausted by the end of the day. It would have been cool to go into the operating room, but I understood that that was not a part of her job, and I wanted to see specifically what she did. So that was for that shadowing experience. And throughout this semester, I have also shadowed at a dermatology office in East Lansing. At this office, I have shadowed 2 doctors and a PA. This is a much more traditional doctor's office where the patient goes into a room, they get an examination with the MA, and the practitioner comes into the room and addresses the issue that is trying to be solved at that time. I really liked dermatology. At first, I thought it was going to be kind of boring. You just kind of look at moles all day and rashes and some acne treatments every once in a while. I found it to be really inspiring to take care of my own skin and my own health. I have learned a lot about sunscreen, Vaseline, tanning beds, just a lot about basic health needs of the skin. I also was able to learn about dermoscope, which is a fancy microscope that dermatologists use to identify certain moles and things like that. And being able to look at moles under dermoscope was surprisingly exciting. They're very different, very vast, and I had learned about different types of things we get as we age and whether they're normal or abnormal. I also really enjoyed the patient interactions with all the practitioners. They were very kind, very patient-centered. In some other places I've shadowed, I have not experienced that, but this practice had a really good patient-centered care. But they also respected the practitioner's boundaries, which I appreciated. So if a patient came in with a laundry list of things that needed to be done, they didn't necessarily take care of all of it that day. They took care of what was urgent or what the appointment was scheduled for, and then they scheduled follow-ups to respect the practitioner's time because they also have other patients waiting. So those were the 2 shadowing experiences that I've done so far. Some things that I have learned and liked and disliked in both of them. I love shadowing any career, and I look forward to keep learning through that way.